Intussusception is a condition that happens when part of the intestine folds into another section of the intestines, resulting in obstruction. This is commonly referred to as telescoping, because it's similar to how one part of a collapsible telescope retracts into another part. Intussusception is the most common cause of intestinal obstruction in infants and young children, with about 2/3 of them happening among infants under 1 year of age, though adults can occasionally have intussusception too. Now, intussusception usually happens in the ileocecal region of the intestines, which is where the ileum of the small intestine and the cecum of the large intestine meet. And almost all intussusceptions happen when the ileum folds, or telescopes, into the cecum. In adults, telescoping is usually caused by an abnormal growth in the intestine, like a polyp or a tumor, which serves as a lead point or a leading edge. What happens is that the normal wave-like contractions of the intestine, called peristalsis, grabs the leading edge and pulls it into part of the bowel ahead of it. In babies, the leading edge is most often caused by lymphoid hyperplasia, or the enlargement of the lymphoid tissue. There are a ton of tiny lymph nodes sprinkled through the intestines called Peyer's patches, and they're particularly common in the ileum. When a child gets some sort of viral infection in the gastrointestinal tract, usually caused by rotavirus or norovirus, the Peyer's patches enlarge to help fight off the infection, and sometimes become a lead point that drags the ileum into the cecum, causing intussusception. Intussusception can also be caused by a Meckel's diverticulum, which is an abnormal outpouching of gastrointestinal tissue that sticks out of the ileum and into the peritoneal cavity. Occasionally, the diverticulum can invert and stick back into the intestine, allowing it to serve as a lead point that again drags the ileum into the cecum. Although these are well-known mechanisms for intussusception, the majority of cases are considered idiopathic, meaning that they happen without a clear cause. Risk factors include having one previously, or having a sibling with intussusception, as well as having intestinal malrotation, which is a condition where the intestine doesn't rotate correctly during fetal development. Now, when an intussusception develops, the first sign is intermittent abdominal pain that worsens with peristalsis, sometimes causing a child to guard their abdomen. For example, they might swat away the hands of a caretaker, or draw their knees up toward their chest. Other classic findings include vomiting and the presence of a hard, sausage-like mass in the abdomen. There's also a lot of pressure on the walls of the trapped section of the bowel, which squeezes shut the tiny blood vessels running in the walls, causing ischemia, or lack of blood flow, and eventually infarction, death of the tissues. Ischemic and infarcted tissue results in the sloughing off of intestinal mucosal tissue, blood, and mucus into the gut. This can result in red, currant jelly stool, which is a food-inspired visual for the berry jelly consistency of the stool. Fever isn't usually a symptom of intussusception, but in serious cases, like with infarction, the intestines can tear and release bacteria into the body cavity, causing sepsis and fever. Intussusception can also prevent food or fluid from passing through the intestines, causing an obstruction. This can lead to a large mass in the intestines, which can potentially cause the intestine to become twisted, a condition called volvulus. In children, intussusception can sometimes be felt by finger while doing a digital rectal examination, but a definite diagnosis often requires imaging techniques. An ultrasound, X-ray, or computerized tomography, or CT scan, can reveal a classic bullseye, which represents the telescoped intestine shown on end, as well as signs of intestinal obstruction. Intussusception can develop suddenly, and because of the possibility of intestinal ischemia, rapid treatment's necessary. A barium or air enema can be used to unfold the intussusception, especially in children. If it doesn't work or if there's a complication, then surgery might be necessary. During surgery, the portion of the telescoped intestine is freed, any obstruction is cleared, and any tissue that died is removed. Alright, as a quick recap, Intussusception happens when part of the intestine slides into an adjacent part of the intestine, a process called telescoping. Intussusception can lead to intestinal obstruction and can also cut off the blood supply to that part of the intestines, resulting in bowel ischemia. Rapid treatment's important and can be done with a barium or an air enema, as well as surgery if needed. Thanks for watching. You can help support